Surgical site infections, which I will refer to in this video as SSIs, are a common and costly cause of healthcare-related infections. According to Anderson, they can add an additional 7 to 10 days onto a patient's hospital stay, as well as increase the risk of death by 2 to 11 times. According to the Joint Commission's Implementation Guide for Surgical Site Infections, the national safety goal requires education for patients undergoing a surgical procedure about surgical site infection prevention. The model for improvement that will address the safety issue is outlined on the Institute for Healthcare Improvement 2017 website. We will begin with our aim, which will be to educate 100% of the preoperative patients that will be scheduled for an elective surgery on SSI prevention. For the plan and do portion of the safety improvement, the nurse can begin by going over a risk factor checklist with the patient. A history of recent illness or infection because the patient's immune system will be compromised. A history of MRSA. According to Smith and Dalen, initiating treatment preoperatively for carriers may decrease the SSI rate as much as 82%. A history of low albumin, because patients that are malnourished are more susceptible to developing SSIs. A history of steroid or immunosuppressive medication. Again, according to Smith and Dalen, these medications have been found to have increased SSI rates and inhibit wound healing by impairing the immune system. A history of diabetes. An optimal A1C of 7 or below is desired per the American Diabetes Association. Diabetics will have greater impaired wound healing due to vascular compromise, as well as high blood glucose can lead to increased infection rate. History of current tobacco usage. According to McDaniel and Browning, normal tissue oxygenation is necessary for cell repair to wound sites, bacterial defense, and collagen formation. Even a 4-week cessation prior to surgery will improve risk of infection. There are opportunities for some elective surgeries to be postponed, for example, carpal tunnel, if risk factors can be improved or eliminated. If not, patient awareness alone will give the patient a better understanding of eliminating any risk factors within their control. Second, the patient will be educated on preoperative skin cleansing with chlorhexidine. According to D'Oliveira and Gamma, bathing with an antiseptic at least one night before surgery has been referenced in various global guidelines and recommended by the CDC. Even the use of chlorhexidine body wipes after a shower is an efficient and effective method to clean the skin per Kernan. Lastly, the importance of proper hand washing will be stressed. Patient will be taught according to CDC guidelines and also given a handout. The patient needs to understand they should question anyone involved in their care if they do not witness them washing their hands. The study and act portion will happen post-operatively, which is normally 10 to 14 days after surgery. The checklist will be retrieved and reviewed. The measurable strategies will include: did the patient understand the teaching regarding reducing risk factors related to developing an infection after surgery? Yes or no? If no, how can we improve this? Get feedback from the patient. See what they do remember. Did the patient follow through with any recommended changes, such as smoking cessation, improved diet, prophylactic antibiotic therapy, proper hand washing? To date, are they continuing these behaviors? Have they initiated any other preventable measures? And do they have any questions? If they have discontinued any of these behaviors, please explain to the patient the need because the body is still healing. And third, has the patient developed any complications to the surgical site? This could include excessive redness, purulent drainage, positive wound culture, delayed wound healing, and wound dehiscence. These patients will be followed until the surgical site is completely healed. Surgical site infections are preventable, and the healthcare team must be fully aware of the importance of providing the patient with high-quality information and teaching before surgery. By taking the time to further educate the patient, it may be one more step in preventing an infection from occurring. Thank you for watching this video.